Dear students, welcome back. In the previous session, we have discussed about knee joint capsule. Now in this session, we are going to discuss about knee joint ligaments. Okay, before discussing about different kinds of knee joint ligaments, so first we should discuss about what is the role of these various ligaments. Okay, the roles of these various ligaments of the knee have received extensive attention, and their roles reflecting their importance to knee joint stability and the frequency with which function is disrupted through ligamentous injury. Okay, so if any lack of bony restraint to virtually any of the knee motions, then the ligaments are credited with resisting or controlling different kinds of motions. So the first one is it controls the knee joint ligaments, controls excessive knee extension, and it is also controls varus and valgus stresses at the knee. Okay, and anterior or posterior displacement of the tibia. So these are controlled by these ligaments only. One is excessive knee extension is controlled by knee joint ligaments, and also varus and varus valgus stresses are also controlled by the ligaments, and anterior and posterior displacement of the tibia beneath the femur is also controlled by this knee joint ligaments. And also, what are the other rotatory motions like medial or lateral rotations of the tibia beneath the femur is also controlled by knee joint ligaments. It is also controlled. These ligaments are going to control combinations of antero-posterior displacements and rotations of the tibia. Okay, that means it is these ligaments are going to control all these combinations and helps in rotatory stabilization. So these are the various roles which are performed by knee joint ligaments around the knee joint. Okay, here the students, you have to keep it in mind that although the tibial motions we have discussed in the functions, isn't it, role? So sometimes due to some literature, what they have given to the names of anterior posterior displacement and this rotational displacements you have seen, if they're given some names for these displacements, so they have given AP displacement of knee joint. That means what you people have to consider is whether the femur is displaced from the tibia. That means when the tibia is fixed, the femur will be moving. Then how these names are given. So when tibia is fixed or femur is fixed, on the femur, on the tibia, the femur is displacing anteriorly or posteriorly, or when the femur is fixed or the tibia is displacing anteriorly or posteriorly. These two things you have to keep it in mind. Okay, for example, if the AP displacements and rotations of the tibia is also considered when there is a displacement of the femur also. That means if you consider in a weight bearing position, that means the tibia is fixed. So if tibia is fixed, then what will happen? The movements are taking place by the movement of femur. Okay, this femoral condyle will move on this tibia. So then what happens? If there is an posterior gliding of this femoral condyle, then how it appears means, so it is moving somewhat posteriorly. That means it appearing as tibia is displacing anteriorly. Okay, so that means if there is a posterior gliding of the femur on the tibia is also causing anterior displacement of the tibia. Or femur is stable, okay, then there may be movement of tibia. So if tibia is moving, then relatively this femur is present on the posterior aspect, and this anterior aspect of the tibia is moved anteriorly. Then also it is considered as anterior displacement. So on the both ways you have to consider. So on the both ways, if only tibia is moved anteriorly, then only it is called as AP displacement. If there is any gliding of this femoral condyle towards the posterior aspect on a stable or static tibia, then it is also called as anterior displacement of tibia. Okay, such things you have to analyze. Okay, so these 2 points you have to keep it in mind when you are dealing any cases clinically also. Okay, yes. Now we are going to discuss about various knee joint ligaments. There are variety of knee joint ligaments are there which are going to give support to the knee joint. Okay, some are collateral ligaments, which includes medial collateral and lateral collateral ligaments. Okay, here you can see this one is medial collateral and lateral collateral ligaments. Okay, these are the ligaments. So these are collateral ligaments. And next one is the and also here the iliotibial tract is also giving support on the lateral aspect. So iliotibial band also we have to consider under this ligament regarding biomechanical aspect. Okay, and it is also having some cruciate ligaments which is very important, that is anterior cruciate ligament and posterior cruciate ligaments. And next ligaments are posterior side will find posterior capsular ligaments are also present. And another important ligaments, that is coronary ligaments, so which are attached from meniscus to the tibial condyles. These are coronary ligaments. So in this session we are going to discuss about all the ligaments except cruciate ligaments. We will discuss this cruciate ligament in the next session. So first of all we'll see this collateral ligaments now. So what are the collateral ligaments? Two collateral ligaments are present. One is the medial collateral ligament and lateral collateral ligament. So here you can find the medial collateral ligament here. So this medial collateral ligament can be divided into superficial portion and deep portion. Simply we can say how this medial collateral ligament is attaching means, simply we can say it attaches to the medial aspect of the femoral condyle. So this is the medial aspect of the femoral condyle, epicondyle, sloping anteriorly. It is sloping anteriorly to insert into the medial aspect of the proximal tibia. Okay, So this is the thing we can visible this ligament like this. Okay, this is the attachment. If you write this point is also enough for medial collateral ligaments. Okay, if they asked for many, that means for we can say it may ask it for an essay or some short, you have to explain in detail. So that thing now we are going to discuss about this. So the medial collateral ligament is divided into superficial portion and a deep portion, and that superficial portion and the deep portion is separated by a bursa. Okay, the superficial portion of the medial collateral ligament arises proximally from the same medial femoral epicondyle and travels distally and insert into the medial aspect of the proximal tibia distal to the pes anserinus. Okay, this superficial portion of the medial collateral ligament attaches anterior origin of the posterior oblique ligament. So already this one is present on the lateral aspect. On the posterior aspect we are having this what you called as posterior oblique ligament. Okay, that posterior oblique ligament anterior side is attached to the medial collateral ligament. Okay, and next, and it is also attaches to just distal to the femoral insertion of medial patellofemoral ligament. So here that is the point, exact point on the distal side. So this is about the superficial portion of the medial collateral ligament. Now if you see the deep portion of the medial collateral ligament, so deep means we can go up to the knee joint capsule. So around the knee joint on the lateral aspect we will have the capsule, isn't it? So that is the very deeper portion of the knee joint. Okay, so this deep portion of the medial collateral ligament is continuous with the knee joint capsule. Okay, it originates from the inferior aspect of the medial femoral condyle and inserts on the proximal aspect of the medial tibial plateau. So still here. Okay, so this is going to insert here. So these are the two portions. If you see this medial deep portion, throughout its course it is rigidly fixed to the medial border of the medial meniscus. So it is going to attach with the medial border of the medial meniscus. That too it is attached very rigidly. Okay, this is the attachment of the medial collateral ligament. Okay, if you see the function of this medial collateral ligament, the medial collateral ligament, specifically the superficial portion, is the primary restraint to excessive valgus. So this one is helps in the protection against the excessive valgus stress. So like this, valgus stress. Okay, and also it also gives restraint to the lateral tibial rotation. That means the tibia will rotate like this. So in these two cases, the medial collateral ligament acts as a primary restraint. Okay, so the knee joint is better able to resist a valgus stress at full extension compared to a position of knee flexion, because the medial collateral ligament is taut in extension, whereas during joint flexion the medial collateral ligament becomes more lax, and it gives greater joint space. Opening is possible on the medial side. With the knee flex, the medial collateral ligament plays a more critical role in resisting valgus stress along with the permitted joint gapping. Okay, so these are the main function of the medial collateral ligament, and it is having a secondary function called as supportive role in resisting anterior translation of the tibia on the femur in the absence of primary restraints against anterior tibial translation. That means the ligaments which are going to restrict this anterior translations, tibial translations, if they are not working properly, then this medial collateral ligament is going to take that supportive role. So because of its secondary role as restraint to anterior tibial translation, both partial and complete medial collateral ligament tear happens, it will cause significant increase of load on the medial side. Okay, and also which causes increase in load on the anterior cruciate ligaments also. Okay. And if the individuals having medial collateral ligament injury may need protection from valgus and lateral rotation forces, especially when it get tear, or if any newly reconstructed anterior cruciate ligament grafts are present. Okay, and very important thing is the medial collateral ligament has rich blood supply, which is providing the medial collateral ligament to heal by itself when it is ruptured or damaged. No surgical treatment is required based upon the tear. Okay, if any isolated medial collateral ligament injury is done, the ligament will often heal on its own. If any combination of any other ligament is there, then surgical intervention is needed to correct this medial collateral ligament. Okay, so this is all about the medial collateral ligament. Now we will see the lateral collateral ligament. So here we can find this is the lateral collateral ligament. This lateral collateral ligament is located on the lateral side of the tibiofemoral joint, which is attaching proximally from the lateral femoral condyle to the lateral collateral ligament, which then travels distally to the fibular head. So where it joins the tendon with the biceps femoris at the distal end. Okay, and these two forms the conjoined tendon. The medial collateral, unlike the medial collateral ligament, the lateral collateral ligament is not a thickening of the capsule, but it is separate throughout much of its length and is therefore considered to be, this ligament is extracapsular ligament. The lateral collateral ligament is primarily responsible for resisting the varus stresses. So these are very much, these ligaments are very much restrained to the varus stresses. Okay. This is about this lateral collateral ligament, and the primary role of this lateral collateral ligament is to resist varus stresses, and its orientation enables the lateral collateral ligament to limit excessive lateral rotation of the tibia also. So this is also limiting the excessive lateral rotation of the tibia. So these are all about the collateral ligaments. Now we will move on to the other ligaments except cruciate ligaments. And you can find the iliotibial band here. So this one is the iliotibial band. This iliotibial band or tract is formed proximally from the fascia, that is tensor fascia lata. So tensor fascia lata, gluteus maximus and gluteus minimus. So all these two, gluteus maximus and gluteus medius muscles. Okay, it continues distally to attach the linea aspera of the femur through the lateral intermuscular septum, and which is inserted into the lateral tubercle of the tibia, which is reinforcing the antero as well as the lateral aspect of the knee joint. Okay. Although there are muscular connections to the iliotibial band, some of the investigators considered the iliotibial band to be essentially a passive structure at the knee joint, since contraction of either tensor fascia lata or the gluteus maximus muscle did not produce any longitudinal excursion of the distal iliotibial band. So those contractions will not affect the function of iliotibial band. Why? Because this iliotibial band normally falls anterior, okay, to the knee joint axis when it is extended, and the iliotibial band action line falls posteriorly to the axis in the flexion. So the direction of iliotibial band is comparable to that of same as medial collateral ligament, and its strength is comparable to that of anterior cruciate ligament. Okay, the main function, if you see here, is, so this iliotibial band, which is having some fibrous connections to the biceps femoris and also vastus lateralis through the lateral intermuscular septum, forms a sling behind the lateral femoral condyle, assisting the anterior cruciate ligament in preventing posterior displacement of the femur when the tibia is fixed. Okay, when the tibia is fixed, it resists the posterior displacement of the femur. Okay, and iliotibial band also some branches or fibers from the anterior margin to the to attach the patella. Okay, so forming lateral patellofemoral ligament. Okay, and this can be used to restrict, okay, abnormal lateral forces on the patella. So this is about the iliotibial band. And the other ligaments related to the knee joint or the posterior capsular ligaments as well as the coronary ligaments. Now we will see the coronary ligaments here. So here we are having two coronary ligaments. One is on the lateral side and another one is the medial side. The coronary ligaments consists of short ligamentous fibers which serves to connect the peripheral convex margins of the semilunar cartilages with the peripheral margins of the tibial condyle. So this one here from the medial meniscus, that is the semilunar cartilages. Okay, so these are very short ligamentous fibers which are attaching from the semilunar cartilages to the tibial condyles. Okay, these actually merge with, these coronary ligaments actually merge with the lower part of the capsule of the knee joint that we have already discussed in the knee joint capsule. Okay, so and now we will see this posterior capsular ligament. Yes, so this one is the posterior capsular ligament. So here this these posterior capsular ligaments are called as oblique posterior ligament, and also we can find arcuate ligament. So this oblique popliteal ligament, okay, it forms the floor of the middle 1/3 of the popliteal fossa. If you see the attachments, above to the lateral part of the intercondylar line of the femur and also to the area of the lateral condyle of the femur. Okay. Fibers are directed downwards and medially and merge with the capsule of the knee. Some fibers are continuous with the insertions of semi-membranous muscles. Okay, so this is the oblique popliteal ligament. Okay, if you see the arcuate ligament, so this is the arcuate ligament here. You can find this arcuate ligament here. So above it is attached to the posterior aspect of the femur. Here, the posterior aspect of the femur, above the lateral femoral condyle, and the fibers which are directed downwards and medially to merge with the capsule. Okay, from the upper and lower end of this ligaments, two bands converge towards the head of the fibula. So here the two bands are coming and these two are going to merge up with the fibula. And the opening in the capsule for the popliteus tendon is situated below the lower band. So below the lower band you can find that opening of the capsule which allows the popliteus tendon to pass on. Okay, so this is these are the ligaments which are attached on the posterior over the posterior capsule. Okay, so these two ligaments were found to play an important role in checking again varus and valgus stresses respectively in the extended knee. And some of the investigators also found some contributions by these structures to checking varus and valgus stresses and providing secondary restraints to other tibial motions. So these are all about the knee joint ligaments except cruciate ligaments. The cruciate ligaments we are going to discuss in the next session. Thank you.